If there is one thing these last couple of years have shown all of us, it is the power of medicine, the advances that we have made in medical research, and the constant ongoing nature of that research. That is true when it comes to treatments, also when it comes to surgeries and alternatives to make your surgical procedure as invasive less, if that's a word, as possible. So we're so happy this morning to have Dr. Ben Geddes on the show. He is with the Center for Sports Medicine, and he's talking today about a different approach to neck and cervical fusions. Good to see you this morning.
Hey, great to see you. Thanks for having me.
I'm glad to have you. So for anyone out there watching who maybe has been struggling with arthritis, that neck pain, that upper cervical pain can just be chronically debilitating. This is a different approach to healing that pain.
Yeah, that's right. I mean, cervical or neck problems are so common. We all experience them at some point in our lives. And, the good thing is most of the time, 90+% of the time, it can be treated with some medicines and some therapy and just giving it time and it gets better. But for that other smaller percent of the time where it just doesn't get better, especially if there's sort of a pinched nerve phenomenon, which is more the pain that goes down into your shoulder or arm region or sometimes down by your shoulder blade, then sometimes it does necessitate, a more invasive treatment for that. And sort of historically, that's been a surgery which is really successful called anterior cervical discectomy and fusion, which is through the front of the neck, and it's a fusion-based operation where you clean out the arthritis or the herniated disc, and you put a little spacer that makes two bones become one. It's called a fusion, and it is really, reliable operation, but the downside is you do lose motion somewhat globally in your neck, but also probably more importantly at those adjacent levels. And we know everyone has a friend that's had surgery on their spine and the next level goes bad down the road. And so, an alternative now to fusion for neck problems is what's called a disc replacement, which is a similar operation through the front of the neck where you go and you clean out, the arthritis or bone spurs and disc herniation. But instead of putting a little spacer that makes those bones become one, you put a little prosthesis like you get in your hip or your knee if you had a hip or knee replacement. It's made out of metal and plastic that moves more like a regular neck. And, with the hope that it will preserve the adjacent levels and just give you globally better motion after the operation.
Okay, I'm trying to understand this since I did not go to medical school. So the area of your body that you go through is the same, it's still through the front of your neck. But you're saying now with the replacement, you're adding, is it like almost like Atlas holding those vertebrae apart? Is that what the device is going to do?
Yeah, either way you need to put something back into the disc space that you've removed to clean up, what's compressing the nerves and causing your symptoms. And so, again, classically with a fusion, you put a little kind of block or spacer in there with some bone grafts so that eventually that disc space is actually just full of bone and doesn't move anymore, but, you've solved the problem of the pinched nerve. With a disc replacement, instead of putting a block in there, you put a little prosthesis, if you will, a little implant that is designed to move, to flex and extend and rotate, just like your neck would do.
Gotcha.
And it's made of similar materials and has a lot of similar principles to other joint replacements we do in the body.
Okay, that makes sense to me now. With the joint replacements in other parts of your body, knee, hip, they've come a long way, and now they are much longer lasting. I think if you do a hip surgery, a hip replacement in your 60s, there's a good chance you could never need another one. What's the lifespan, if you will, of this replacement?
It's a great question. I have a lot of patients that ask me that, and I mean, they haven't been out as long as a hip or knee, which have been out for 60 plus years, and certainly those now, the technology is great. I mean, you can get 30 plus years out of a total hip. We think, honestly, for the neck that you may never have an issue with it. Just the forces that it sees is much different. Obviously, your neck just supports your head; it doesn't support your whole body weight like your hip or your knee would. And so, when they test it in the lab and they put it through millions of cycles of flexion and extension, it seems to be quite durable. So, I think but we think that for most people, it's kind of a one and done type deal. Which is great. And the other advantage that I have a lot of patients that really like about the replacement versus the fusion is the post-operative care is a little bit easier. For fusions, we have to put people in a collar usually, which is a plastic or foam collar for 4 to 6 weeks. So you can't move your neck, you can't drive. But with the replacement, we want you to move after surgery so you can kind of start driving right away as long as you're not on pain medication and you're not kind of locked up in that collar. So just another little perk sort of in the immediate post-operative kind of period.
Yeah, you mentioned the pinched nerve. Is early intervention key? If you're noticing some problems with some tingling down your arm or pain in other parts of your body, if they get in to see you quickly, are there some things you can do to ward this off at the pass?
Yeah, I mean, like I said, I mean, pinch nerves are really common, and it can be caused by different things. I mean, a soft disc herniation, meaning, you're a younger patient, you're in your 30s, 40s, you don't have a lot of arthritis, and just you did something and you herniated a disc. Those most of the time get better, honestly, on their own with medication and given it time, because your body does have some capacity to heal that and kind of resorb that disc. So those are people we definitely try to. You don't necessarily need early intervention, but you try the medicines and the therapy, and you try to just get them comfortable so that their body can kind of do the rest. And a small percentage of the time, it's not working, or they have weakness or something else that makes us think we need to be more aggressive, and then we would do a disc replacement for that. But most of the time, you can kind of wait it out. If it's more arthritis, we still try those things, but that's something that's, even though the symptoms may get better and worse over time and kind of fluctuate, the MRI, the imaging, it's never going to look better. So those people probably at some point, if they have a lot of episodic issues and require a lot of conservative care, eventually they may need something more significant, meaning a surgery for that kind of problem.
Okay, and dumb question perhaps on my part, but when it comes to arthritis, are some people just more prone to developing arthritis than others? And if we are more active in a safe way, I don't mean being a runner pounding the pavement, but if you walk a lot and do what you can to stretch, can you offset the advancement of arthritis?
Yeah, unfortunately, there's no way to either slow or definitely to reverse arthritic changes. I mean, it's certainly the holy grail of musculoskeletal care, and lots of folks looking at it. But different supplements, glucosamine, chondroitin, lots of things that have been looked at. Nothing has really been shown to certainly reverse arthritis. What I tell my patients is I want you to be active. I mean, even if you have arthritis, if you're fit and, not overweight and don't smoke, you likely won't have as many symptoms from it. Even though maybe your x-ray shows that you have significant arthritis, you may be fine, not have a lot of symptoms. And that's one thing that's different and challenging about spine surgery. You have to be really careful to treat the patient and not the imaging, because everyone's symptoms are different. But no, I tell people to stay active, but there's really nothing you can do to sort of prevent, certainly to reverse arthritis, unfortunately.
All right, we got to wrap it up, but you did tell me that y'all are still operating at full procedure, so that the hospital appointment can be made pretty quickly. Don't hold off waiting for that surgery if you need it, right?
That's correct.
Great talking to you this morning, Dr. Geddes. We appreciate it very much.
Thank you.
You can find him and the whole team there at Center for Sports Medicine at their main office on Macaulay Avenue. They have lots of locations around town, though, so if you go to sportmed.com, you can see the one closest to you, or just call 624-2696. We're back after this.